I've been coming here 4 years. I was having chronic lower back pain and was affecting my work and not being able to work as much as I used to.
I have been seeing Dr. Forsythe about 2.5 years now. We always went to a chiropractor. We moved to Kelowna 2.5 years ago, and Dr. Forsythe was recommended to us by our former chiropractor where we lived, and that's how we ended up here.
I've been a chiropractor for 40 years now. I had an ankle injury that didn't resolve over a year's time, and by chance I'd strained it again, and an uncle who was a chiropractor was visiting, and we got talking about it, and he said, let's have a look. And he said, well, little wonder it hasn't healed up, and he fixed it, and that was the end of my career of being a dentist.
My health has improved, not only just my back pain and being able to carry on my work, but finding that other symptoms that I didn't realize had gone away, whether it was heartburn, sinus, congestion. I found that those things had slowly gone away and not even realizing that it was because of the chiropractic.
Some of the tools we use in our office to be able to determine what the problems are is the first one is a computerized nerve scan that tests the 80 to 90% of our nervous system we don't feel. The second one is we use X-ray, okay, to determine the quality of the bone underneath, whether there's any degenerative changes or maybe there's even abnormalities in how that person's spine developed to start with. We do motion analysis of the spine to see how well it moves, not only from a global sense but from individually how the vertebrae move. We also have gait analysis equipment. This is computerized technology to be able to monitor how you walk and how your foot strikes the ground, and be able to, some people need customized orthotics made, and this helps the technology do that.
I'm in construction. I do foundations and framing of residential homes, and I'm finding with the chiropractic I'm still able to work beside my 20-some-odd-year-old workers and keep up to them.
When I first switched over from manual adjusting to activator adjusting, a couple, a husband and wife were patients of ours, and she had a real bad weak lower back, and we had to carry her into the office, her husband and I literally carry her into the office, and we had just received our tables, and we put her down on the table, and I started the procedure. I mean, I would never have been able to have done anything much in the way of help for her when doing manual care, but we got her down on the table, went through the activator assessment for her pelvis, saw that there were some problems there, adjusted it, and she said, the pain's gone. And she was a bit of a jokester, and I thought, you know, she's just kidding me. I said, what do you mean the pain? She said, the pain is gone. I said, you're kidding. She said, no. She's let me up and I can show you. And it was just that, and I said, whoa. I would never have had that kind of results using manual care at that time.
We have and we will recommend Dr. Forsythe to family and friends.